many types of cancers, but I've decided to talk about leukemia. I have educated myself on this condition after my cousin was diagnosed with it when she was only 6 years old. I got to see everything she went through from the diagnosis until the treatment. Fortunately, she had successful recuperation and she's now living a normal and healthy life. Throughout this speech, I'll be talking about the different types of leukemia, as well as its main symptoms and treatments, and how it is diagnosed. According to the American Society of Hematology, by definition, leukemia is a type of cancer found in the blood and bone marrow caused by the rapid production of abnormal white blood cells. These white blood cells are not able to fight infection and impair the ability of the bone marrow to produce red blood cells and platelets. As stated by the Leukemia Research Foundation, more than 387,000 of Americans are living with leukemia. Leukemia can be either chronic or acute and can be categorized as lymphocytic or myelogenous. Acute lymphocytic leukemia progresses rapidly, replacing healthy cells that produce functional lymphocytes with leukemia cells. These leukemia cells are carried into the bloodstream to other organs and tissues, including the brain and the liver, where they continue to grow and divide. Acute myelogenous leukemia occurs when the bone marrow begins to make blasts, which are cells that have not yet completely matured. It is also the most common type of leukemia in adults. Chronic lymphocytic leukemia is a slow-growing cancer that starts in lymphocytes in the bone marrow and extends into the blood. Many abnormal lymphocytes grow, crowding out blood cells that the body needs to fight infection. Lastly, chronic myelogenous begins in the blood-forming cells of the bone marrow and over time spreads to the blood. According to the American Cancer Society, about 15% of leukemias in adults are chronic myelogenous. As it is shown in this graph provided by the National Cancer Society, there are 61,780 estimated new cases of leukemia in 2019, while there are only 22,840 estimated deaths. This also shows the survival rate of leukemia over the past 5 years, which is 62.7%. The cause of leukemia is not known, but scientists believe that it is a combination of genetic and environmental factors. Some factors that may increase the risk of leukemia include smoking, exposure to high levels of radiation, family history, and gender, considering the fact that it affects more males than females. The symptoms differ depending on the type of leukemia, but the most common signs include fatigue, shortness of breath, easy bruising or bleeding, anemia, and weight loss. Leukemia can be diagnosed by conducting a bone marrow test, a physical exam, and a blood test. By conducting a physical exam, a doctor can look for physical signs of leukemia such as pale skin from anemia, swelling of the lymph nodes, and enlargement of the liver and spleen. By looking at a blood sample, a doctor can determine if a person has abnormal levels of white blood cells, red blood cells, or platelets. By conducting a bone marrow test, as it is shown in this picture provided by the National Cancer Institute, bone marrow is removed usually from the hip bone using a long, thin needle. This also shows what a healthy bone marrow looks like and what a bone marrow looks with leukemia. Treatment varies depending on the type of leukemia a person has been diagnosed with, but the most common treatments include chemotherapy, which is the use of a wide variety of drugs injected into a vein or taken by mouth to destroy cancer cells. Radiotherapy, which keeps cancer cells from growing by using radiation. A person may receive radiation in one specific area of their body where there is a collection of leukemia cells. A stem cell transplant, also known as a bone marrow transplant, is a procedure in which damaged stem cells are replaced with healthy ones. As it is shown in this picture provided by Harvard Health, healthy bone marrow cells are removed from the donor and those same cells are injected into the recipient. Wellness treatment is targeted therapy, which consists in targeting specific genes or cells with the purpose of stopping their growth. Targeted drugs can have many side effects, but they can be helpful when chemo isn't, or they can be used along with chemo for better results. Unfortunately, leukemia is one of the most common cancers, especially in children and teens. The purpose of this speech is to understand the different types of leukemia, its symptoms and treatments. and raise awareness on this critical condition that affects thousands of Americans each year. Thank you.